Hello, my name is Camrynn Shellman, and today I'll be introducing our Homeostasis project on multiple sclerosis, or otherwise referred to as MS. Our group members for this project are Mackenzie Simkins, who will be talking about the causes of MS, Sydnie Williams talking about the effects of MS, Makayla Oliver talking about prevention and cure, and Shelby Hanna talking about what it's like living with MS. A quick intro to MS. In the U.S. today, over 1 million people are living with multiple sclerosis. MS can be caused by a couple environmental factors, including things like exposure to smoking, vitamin deficiencies, and exposure to infectious agents, but these are not proven causes of MS. This disease cannot be known at birth, and it cannot be prevented. Women are more likely to be diagnosed with MS than men, but when men are diagnosed with MS, it is commonly at the worst stage. MS affects and creates disorders of motor function and coordination, of cranial nerve function, of autonomic, cognitive, and physiological functions. There is currently no cure for MS yet, but there are many different research projects trying to find some type of cure or prevention. Now I will hand it over to Mackenzie, who will get into more depth about causes of MS.
The exact cause of MS is not certain, but we know that the development of MS comes from both genetic predisposition and environmental factors. Genetic predisposition plays a role in MS. Identical twins with 100% genetic similarity have a 25% risk rate of having MS. This decreases drastically when you have first-degree relatives with a 50% genetic similarity to only a 2 to 5% risk rate. It has been shown that in the human leukocyte antigen region of chromosome 6 exists a group of genes associated with increased risk of MS. Environmental factors include exposure to viral and bacterial agents such as Epstein-Barr virus, human herpes virus type 6, and Mycoplasma pneumonia. These viral and bacterial agents may have a nuclear antigen that is structurally similar to myelin sheath components. So, when immune cells are activated by these pathogens, lesions will form on the myelin sheath. Smoking, vitamin deficiency, and low exposure to UV radiation can also lead to the onset of MS. Nitric oxide, a toxic gas that is produced by smoking, can damage neurons and result in demyelination. Carbon monoxide is also produced by smoking. Exposure to carbon monoxide leads to blockage of tissue oxygenation, myelin basic protein degradation, and causes an inflammatory response that results in demyelination. Deficiency in vitamins D and B12 are risk factors for MS because vitamin D plays a role in gene expression, immunity regulation, and the suppression of pro-inflammatory cytokines, and vitamin B12 is an important factor in the generation of myelin shell components. Therefore, a deficiency in vitamin B12 can be a major cause for MS and other neurological diseases. Because fish have vitamin B12, there is an association that people who eat more fish tend to have a lower risk of MS, and people who have a high animal fat intake tend to have a higher risk of MS. MS is far more common in countries with temperate climates because of the low exposure to sunlight, causing a higher risk of vitamin D deficiency.
The effects of MS. MS is a condition that takes a huge toll on an individual, and it usually has what they classify as 4 stages of MS. So first we have the clinically isolated syndrome, which they call CIS, which is the first episode that you get of neurological symptoms. They don't technically call this MS at this point until they have reoccurring symptoms that are worsening. The second is going to be relapsing remitting MS, RRMS. The most common disease course is what they call this. A lot of people have clearly defined attacks of new or increasing neurological symptoms. They classify these attacks as relapses or exacerbations of MS. The third type of MS is secondary progressive MS, SPMS. This follows the initial relapsing remitting course, the RRMS. Some people go into this phase. Not a lot of people do. It's less common. This causes more nerve damage or loss. The fourth is primary progressive MS, PPMS. This is characterized by worsening symptoms. These people usually have problem walking, doing daily exercises, have to quit the workforce, and usually have to have care. This is the worst form of MS. How does MS affect homeostasis? The first way that MS affects homeostasis is through the T cells in your immune system. They are impaired, which T cells develop the stem cells in bone marrow. So when the T cells are impaired, the MS patients usually end up with a compromised immune regulation. The second way that MS affects homeostasis is through the central nervous system. MS targets the brain and spinal cord. In MS, the immune system attacks the myelin sheath, which covers the nerve fibers. And so, in result of this, it causes a communication problem between the brain and the rest of your body. So you're not able to do the functions you would normally be able to do, say walk, or that's why you feel a tingling sensation in most of your body. MS has different ways of affecting different sexes. Usually in women, they tend to have more prominent lesions on the brain. So when you're looking at an MRI scan, women's lesions or spots on the brain usually tend to show much more, and they're easier to detect on the scan. But when women usually get MS, they typically do not have a super intense stage of it. They typically have less neurodegeneration than men. When men have it, they have a higher risk of getting PPMS, which is the worst case of MS. So when men get it, it typically is a lot worse than women. Men usually have to quit their jobs, need help in life, usually cannot achieve daily functions by themselves.
There is no treatment for multiple sclerosis, but many people can take preventative measures to decrease the amount of severity and flare-ups that they get. Treatments for MS include corticosteroids to reduce nerve inflammation and plasma exchange, where blood is removed and the plasma is separated from the blood cells, and the blood cells are mixed with a protein solution and then put back into the body. There are injectable treatments such as interferon beta medications that are mostly that are the most common prescribed medications to treat MS. They're injected into the skin or muscle to help reduce the frequency and severity of relapses. And then there are also oral treatments that are usually taken once or twice a day and generally help to reduce relapse rate. but the main difference is the side effects that come along with a certain medication for the oral treatments. There are also infusion treatments such as Ocrevus, which is the only FDA-approved treatment to treat relapse remitting and the primary progressive forms of MS.
I was diagnosed with multiple sclerosis last August and have been navigating my diagnosis and symptoms since then. My symptoms began with some like numb and tingling feeling. It was mostly in my hands and legs initially, and it was just about right when I would wake up in the morning and about 10 minutes before I would go to sleep. It was pretty short lived, so I didn't think much of it. And then one day it didn't go away, and it was more of a global numbness and tingling feeling that stayed. So upon going to the doctors, they decided that I most likely had a vitamin D deficiency, and it was somewhat dismissed until about a month later when I went in for an MRI and my neurologist found lesions that she determined to be from multiple sclerosis instead of concussions. This MRI scan shows lesions formed by concussions. What you really need to pay attention to is the fact that they're like circular dots. They're more just like spots on the brain scan. Some of them don't really have much of a shape to them. They're just more just like round spots. If you notice, these lesions are more of vertical dashes. They like strike kind of upwards from the middle of the brain versus the concussion lesions that are just the spots. So this vertical orientation is how a lot of times the difference between a lesion formed by concussion and a lesion formed by multiple sclerosis are differentiated. These um, are what depict the demyelination of neurons. In my stage of MS, since it's still pretty early on, I only have one lesion that exhibits the demyelination. So most of the actions I take for it at the moment are preventative. So I currently have instructions to take 20,000. I use a vitamin D per day, along with calcium to help with absorption of that vitamin D until my vitamin D levels rise to um, into the 30s and 40s, where it could potentially help stop the formation of more lesions. Upon my next visit to the doctor, they are looking to perform a spinal tap to see if they can find any rings in my white blood cells that would show the evidence of my immune system attacking that myelin. So, but at the moment, symptoms wise, I still only experience the global numbness, no stiffness or weakness in grip strength or anything like that at the moment.